COVID-19 has definitely impacted the healthcare industry as a whole. A lot of these COVID patients come in with upper respiratory symptoms, and the first thing that the provider is going to order is a chest x-ray.
We know that this is going to save someone's life. One day this is going to be your sister, my dad, my mom.
The great thing about nursing is there's a big diversity. Like, you don't always have to do blood and guts. You can also do like nursing management. You can help with public care.
At first I thought that I didn't want to deal with like people, and I wasn't like a people person, wasn't very good at like doing customer service or whatever, but then I realized that it's like I grew to like helping others.
You get to see people get well, you're in close contact with individuals, you're there during their darkest hours.
I know several classmates that have had bad experiences as like a patient, and taking that experience and making sure that it doesn't happen again as a nurse, and looking out for that and changing policies, changing protocols, changing the way that other nurses think from that experience is really important. And I think that bedside manner plays a lot in the nurse's role.
The big misconception with radiology is you have the patient put their chest on a plate, you tell them to hold their breath, and you take the image. And we make that look so easy because we are competent by the time we get there.
Almost everybody gets a job right away, usually starting at about $50 an hour. Usually at the hospital they trained at, and usually they get benefits, and considering the amount of training you have to go through, I think it's an amazing thing to do, and it's a fun job. You get to work with people, you get to feel like you're doing something useful for humanity.
Being that I have worked as a HIV counselor, a medical assistant, and currently as an emergency room technician, felt it's only right to expand my horizons and take that next step.
You can grow into CT or MR, or get into management or education, state law. This is an ever-expanding field.
Healthcare evolves, and I think that's what's very, very central to this program.
City College will give you a run for your time, and you'll really be tested, but ultimately it's to make you not just a better nurse, it's just a better person, because you go over and beyond as they do for you.
Just power away at your classes, try to do your best.
I feel, blessed that I'm in this career, especially during the pandemic.
Even more now than ever, nurses are needed. So very excited to have this knowledge now in my tool belt, and City College especially preparing me to be there on the front lines and helping out is really exciting.